Thanks for joining us on Medwatch today. I'm Vanessa Villafuerte. When hip pain gets in the way of your daily routine, a replacement might be the next step. One local patient says surgery helped him get back to his active lifestyle. After suffering from hip pain for years, John Farrell knew it was time to do something about it.
The surgery was in 2023, and I began to have pain probably 2 or 3 years before. Avid tennis player, so I was able to identify it. And so I dealt with the pain as much as I could until I just couldn't bend over and tie my shoes and, things that I needed to do.
John says he's no stranger to hip surgery. He's had a hip replacement before, but this time he was presented with a different approach.
He told me it would probably be a better recovery from the first one, because on the first hip, they went in from the side and had to do a lot more damage to the musculature in my right hip. And this time he said they were going to go in from the front, and the invasion, as it were, it was going to be much less invasive.
John decided to go through with the second replacement and was surprised by how well it went.
And to be honest, the recovery was much better and much, I would say, easier than I expected.
His procedure was done by Dr. Robert Kollmorgen, an orthopedic surgeon and UCSF Fresno faculty member.
Joint replacement in and of itself is probably, orthopedically, is one of the most frequently performed procedure in the United States. Total hip in and of itself is done by the hundreds of thousands a year.
With advances in surgical techniques, Dr. Kollmorgen says recovery is now faster.
Our physicians are all faculty at UCSF. In the end, sitting down and having a conversation with the patient, I think, is the best we can do in educating.
These modern techniques are making surgery and recovery better for patients of all ages.
I think historically you would think of somebody over the age of 60, but anymore, that's not true.
Dr. Kollmorgen says recently he's seen patients that are in their teens.
I think with the modern implant and modern technologies we have, really it's a great operation for those that need it to get them back to any activity they want.
And for John, that meant returning to his active routine sooner than he expected.
I'm trying to regain as much strength as I can, but the hip itself, going back 2 years to when the hip was replaced, I would say that I recovered much more quickly than I thought I was going to, and my strength returned, my activity returned.
An avid tennis player, John says he's just glad to be back on the court. And his advice to others who might be putting off the procedure is to focus on the better quality of life that comes after surgery.
Well, I guess the one thing I would say is that I think people might be prone, even some of what I've said today might cause someone to kind of, I don't know if I want to go through the pain. The 4 or 5 days of pain afterwards was nothing compared to the 2 or 3 years of pain that I had, moving into the surgery. But, day 3, day 4, it's passed, and you're already doing better.